This is tooth dissecting forceps, and this will have a tooth at the tip of the one blade and a groove at the tip of the other blade. The tooth are designed so that the tissue may be better gripped and there is less chance of slipping. This is used to hold the tough structures like skin, fascia and aponeurosis. This is fine-tipped tooth dissecting forceps or Adson's tooth dissecting forceps. This is used to hold the cut margins of the prepuce for suturing during circumcision. These are DeBakey's plain dissecting forceps. This will have transverse serration at the tip of the blades, which helps in lifting the tissue and needle during the suturing. And there are grooves on the shaft of the instrument which allows easy gripping. This is used almost in all operation to hold delicate structures like peritoneum, vessels, nerves and muscles during dissection and suturing. This is Mayo's blunt pointed scissors. It can be used for cutting sutures or dressing, or it can be used during appendicectomy operation to split the internal oblique and transversus abdominis muscle, or it can be used to cut tough structures like linea alba or external oblique aponeurosis. These are Spencer-Wells hemostatic forceps, commonly known as artery forceps. Now the blades are provided with transverse serrations, and the tips of a hemostatic forceps are conical and non-toothed. So how will you differentiate it from a needle holder? Needle holder is relatively heavier instruments, and the blades of the needle holder will have crisscross serrations and there will be a groove in center of the needle holder. Now the artery forceps is used to hold the bleeding vessels while cutting through the different layers of tissues, or it can be used to hold the cut margins of the structures while making an abdominal incisions or during the closure of the incision. Now how will you control the bleeding while making an incision? The answer is you may control it by a simple pressure. Fine capillary bleedings will simply be controlled by a simple pressure with a mop. You may use artery forceps to crush the bleeding point. Now the crushing of the bleeding point will cause the curling of the tunica media and intima inwards, which will result in occlusion of the lumen of the vessel. Or you may hold the bleeding point with the hemostatic forceps and apply a diathermy to the hemostatic forceps, which will result in coagulation. Or you may use a ligature like chromic catgut to control the bleeding. Now what is primary hemorrhage? Primary hemorrhage is one in which the bleeding occurs during the operation or at the time of the injury. Reactionary hemorrhage occurs within 24 hours following the operation or injury. This may be due to slippage of the ligature or dislodgement of the clot. Secondary hemorrhage occurs within 7 to 14 days, and this is usually due to infection or sloughing of the vessels. This is mosquito hemostatic forceps. This is used to hold the fine bleeding vessels during the operations like cleft lip operation or used in circumcision. This is usually used for the operation in infants and children where the vessels are delicate. This is Cocker's hemostatic forceps. These forceps have tooth in one blade and a groove in the other blade. And this type of forceps is suitable for holding vessels in tough structures like palm, soles and the scalp. This is Mixter's right angle artery forceps or Lahey's forceps. The terminal part of the blade are bent at right angle to the shaft of the instrument, and there are transverse serrations in the blade. And due to this right angle bend in the shaft, this is usually used to pass the ligature around the dissected vessel. This is Blalock's needle holder. There are crisscross serrations in the blade, and there is longitudinal groove in the center of the crisscross serrations, which allows for the firm gripping of the needle. And the needle is usually held at the junction of anterior 2/3 and the posterior 1/3 for ease of suturing. This is Rampley's swab holding forceps. This is a long instrument in which the blades are oval and fenestrated and provided with serrations on the inner aspect. Now, why is the instrument long? So that the surgeon is able to apply the antiseptic solution to the skin without touching the unsterile field of operation. And also, swabbing can be done at the depth. Now, usually for the abdominal operation, the skin from the mid-chest to mid-thigh is cleaned. This is Allis tissue forceps. The tip of the blades are provided with sharp teeth with grooves in between. And after you close the blades, there will be gap in between the blades which can accommodate some amount of tissue. This is used to hold the tough structures like flap, fascia, aponeurosis or sheath. This is Babcock's tissue forceps. The terminal part of the blades are curved and fenestrated, and as there are no teeth on the terminal part, this is a non-traumatic forceps. This can be used to hold the tubular structures like fallopian tube, appendix or ureter, or to hold intestine or gallbladder. This is Doyen's cross-section type towel clip. It is used for fixing the draping sheets and used for fixing the diathermy cables. Now, what is draping? Draping is a suitable placement of sheets to isolate the area of operation from rest of the body, and draping of the operation sites reduces the contamination from the adjacent skin areas. This is Deaver's retractor. It can be used to retract right or left lobe of liver in the operations like cholecystectomy or truncal vagotomy respectively. It can be used to retract the stomach, or it can be used to retract the abdominal wall as well. This is C retractor. These are L retractors. This is self-retaining abdominal retractor, ball force type. This has also a provision for attachment for the third blade. This is Morris retractor. This is Yonkyo's suction cannula. This is suction tip. This is bone nibbler, double action. This is bone cutter, double action. Punch biopsy forceps. This is Reynolds vascular clamp. This is Cheetle's forceps. This is Doyen's straight intestinal occlusion clamp. The blades are lighter and there are vertical serrations in the blade, and this instrument is used for gut resection and anastomosis. This is cord holding forceps. This is used during hernia operation to hold the spermatic cord so that the cord can be retracted during the repair of posterior wall of the inguinal canal. This is Calli's rectal speculum, commonly known as proctoscope. There is an outer hollow sheath with a handle which is called the scope, and there is inner rod which is called the obturator, and the terminal part of the obturator is smooth and rounded to avoid the trauma. Its diagnostic use are: it can be used for diagnosis of piles or anal or rectal polyp or carcinoma of anal canal or rectum, or diagnosis of ulcerative colitis, or to find the internal opening of the perianal fistula. For therapeutic use, it can be used for injection of piles or it can be used during polypectomy.